I think we're live. Awesome. Yes, we are. Just check the video's coming through, which it is. Guys, welcome to today's live session. We're going to be talking a little bit about why stretching is making your sciatica worse. This is coming from one of the questions of the members poll specifically. So I'm going to get into that first and foremost, and then we're going to go through some other questions, bits and pieces. If you guys have any live questions, you can post those in the comments, all things back pain, all things sciatica, and we'll be going through those today. Hopefully it's going to be helpful for you guys. And Tara, thank you. I am feeling better. My eye is, as you can see, looking a lot better than it was the other day when we had that video posted up. So well on the mend. Thank you very much. A little bit sniffly, but we're nearly there. We're nearly there. So, guys, yes, any questions, post those in the comments, and I'll be getting to those. I've got the comments up over here. I've got them over here as well. So let's get into it. And I want to take this question because it is basically something that a significant number of those of you struggling with sciatica, or even back pain for that matter, will find. You'll find that you go and do stretches like a hamstring stretch, and it makes you feel objectively worse. And if we can approach our exercises, our stretches, with just a little bit of modification, then we're going to find that we get such better outcomes. And what I mean by that is, so often people go, well, I did a stretch and it hurt, and therefore the stretch must be bad. And generally speaking, when we're doing our rehabilitation for our back injuries, we should not be pushing through the pain. We should be working on principles of aggravation-free and correct choreography. And generally speaking, where we violate correct technique, we're going to find, in many cases, that we get an aggravation of the symptoms. And so that's why those two principles are so very important when we're doing our rehab. And the hamstring stretch is no different. Now, in the individual that has significant symptoms going into the leg, many of you will not just have sciatica, the pain itself, but you also have a significant degree of tightness. And for the individual that typically comes to the program or comes to the clinic over the years, we're not talking about having it for a few days. We're talking about the individual that's had this problem for often months, more likely years, and in many cases, longer than that too. And so we acknowledge that we've had this issue there for a long period of time. Why am I talking about that? And this is something that no doubt we'll have a podcast on in the not too distant future, because I think it's something that needs a little bit more explanation, a little bit more exploration. But you've had this problem for a long period of time. Your back pain, your sciatica has been bothering you for an extended period of time, which means you're doing less and less and less. And the symptoms are just getting worse and worse. So what we have now is the tightness may well have been there beforehand, myself included. Often I'm not as flexible as I otherwise could be, and it needs to be worked on. And many of you will fall into that bucket, but equally a good number of you won't. And it's only since having the sciatica that you've noticed you've got this significant limitation in hamstring flexibility. And so what is happening here? The hamstrings on the back of the leg are controlled by the sections of the lumbar spine that you guys have injured. They're controlled by the L5S1, particularly. L4-5 can be involved as well here in giving you those symptoms of tightness in the hamstrings to the point where you can barely do a hamstring stretch. There is a lot of tension and stiffness within those hamstrings, and it is limiting your ability to move the hips. This is a problem for the lower back, because if the hips won't move, the lower back is going to find that movement leaks into it when we're doing ordinary activities. So for example, when we go to get into a chair, instead of just bending at the hips, we round our lower back because our hamstrings won't give us any more movement, so we have to involve the lumbar spine. This is fundamentally why when we're doing a squat or a hip hinge, as we go as far as we can, and we fail to go lower, we round our lower back because our hamstring won't give us any more hip flexibility, so the movement has to come from the lumbar spine. And so in the individual, for example, that just starts the program, if we know for a fact that your squats are limited, your hip hinges are limited, then we know that there is going to be a degree of tightness in the hamstrings. You probably could have said that beforehand. But what we also know is that tightness in the hamstrings is probably very strong. And as you go through, this is why spine stability exercises are so important. As you go through exercises like the dead bug and the marching bridge and the squat and the hip hinge, etc., and you realize you really, really are not strong enough to perform those exercises to a good degree and stabilize the spine, we start to realize, well, what hope does my spine have of being able to effectively stabilize itself against the very, very tight hamstrings as I go to get into the hamstring position? So as I go to do the hamstring stretch and I go to move, immediately my lower back is rounding because my hamstrings are so powerfully tight and my lower back is so woefully inadequate in its strength that it just cannot maintain a neutral position. We discussed this a couple of sessions ago, maybe a few weeks ago now, about using the arm as a kickstand when doing, for example, the glute stretch. But it can also work for the hamstring stretch. We use the arm as a kickstand and then get into the stretch position to almost reinforce the back muscles. But understand that the thing that we need to take from the fact that we're getting pain when we're doing a hamstring stretch is that you are doing it wrong. And you can't help yourself because you're too weak. And so people will go for months and months and months trying to do stretches and just pushing through the pain, not realizing that if you take a step back and focus on building strength, you will then build the strength necessary to correctly execute the stretch and oppose that tremendous stiffness that is being driven by the lumbar spine, not by the hamstrings directly. And so then that leads us to actually have an exploration. No, hamstring stretching didn't make your back pain worse. Doing a hamstring stretch incorrectly made your back pain worse. And more accurately still, doing the hamstring stretch correctly to this specific range of motion, or rather beyond this specific range of motion, was what made you worse. Because if you take a step back and you sit there and you go, right, what's my level of pain right now? Okay, I'm a 3 out of 10. I was 3 out of 10 pain before I started, so we're looking at aggravation-free. If I'm 3 out of 10 and then I put my leg out, okay, I'll move back a little bit for YouTube. If I'm 3 out of 10 here and then I do that, and I'm still 3 out of 10, okay, nothing's happened. Then I go to lean forwards, I'm still 3 out of 10, then I get to here, and you saw my torso kind of started to fold, right? It wasn't a hinge, it was a torso, generally displaying that I'm rounding my lower back at this point. And now I got a 4 or 5 out of 10, you've gone too far. That's the issue. If you'd done a squat and it was so obvious, I go down to here, oh, I wonder why my back hurt, because I'm rounding my lower back terribly during the movement. So I need to take a step back and not go that far. So those of you will find, unfortunately so, that your hamstring stretch, if I just do it standing, might well just be that, because that's all you can control at the moment. And so you stick to that. And as you progress on the rehab front, the strengthening front, with time, you will notice that you start to find you can do a better hamstring stretch. You'll notice the stiffness gets less and less and less. You will notice it's easier to effectively perform the hamstrings, and that the disparity from one side to the other gets less and less. So just having a look through some of the comments here. What else have we got? I'm just going to go through some of the comments over on YouTube, guys, and then I'm going to get on to the TikTok comments as well, guys. So post any down below. Oscar said, thank you so much for the program. Oh, this is cool. Oscar, thank you so much for the program. I was invited with a friend for dinner and I sat down for more than 3 hours with a 2 hours drive I was able to enjoy. Did squats yesterday, 75 kilos, 10 by 5, and step ups 10 to 15. Sorry, 15 kilos, 10 by 5, pain-free. Oscar, that's awesome. Thank you very much for sharing. And do a little post in the Facebook group if you wouldn't mind. Because this is a great example. What Oscar hasn't sat there and done and gone, I want to try and sit for longer because sitting hurts me, so I'm going to just sit for longer. No, Oscar has built, and this is why it's so important. Oscar started out, just like most people do in the program, if not everybody, with body weight exercises, getting the correct technique. And once the correct technique on these exercises, in a way that does not violate the principles of neutral spine, was established, we steadily started to increase the load that we were exposing to. And it's not smooth sailing. There's been bumps along the road. It always happens to everybody because we have to live life every single day. But Oscar's gone through the process of building strength and resilience into his lumbar spine, and that has translated to other things that load the spine significantly for extension become easier. The 3 hour sitting at dinner and 2 hour drive. Because he's built good strength in the spine, this is what we tell you guys to do over and over again. Build the strength through the lumbar spine, and you will notice that the other things that you can't do that are the motivators for you to try and fix your back pain, your back injury, start to get better. And it's so often scenarios like this, or going for a walk with the other half, or these kind of things where you find that someone else notices, maybe someone even at the table that Oscar was with said, hey, Oscar, man, you haven't been able to join us for ages. Are you not in pain? He's like, no, I'm feeling fine. Great, awesome, that's fantastic. It's really, really good. So nice work, and credit to hard work. It doesn't happen overnight. Oscar said here, 5 months in the program, thank you. No? But at the end of the day, what has Oscar done? And this is a question to many of you guys watching. He's recorded himself doing the videos. He's uploaded. When he's had trouble, he's leaned into the trouble. What we can't do is helpful. But then we have to run tests. We have to run experiments. We test things. We adjust the way in which we're doing things. That's why we have the program with support as we go through things. Very important. Very, very important. Just reading some of the other comments in here. Storyteller is not going to lie. I can't afford the program. I have severe sciatica, herniated disc. Please help me out. We do all of this stuff. Storyteller. There's many, many things like this, and the YouTube channel. You just got to do the hard work. You've got to do the hard work, and you've got to trawl through them videos. We have 1,500 plus videos on the YouTube channel. We have approaching 1 million words worth of articles that have been written over the last number of years. Go and read those, study them, and do the work. That's what Oscar's done here. Obviously, he's leveraged the program, you know. But it works out about £15 a week. Right now, as some of you guys know, we have our Black Friday offer running. And I think it's about £9 a week. Most people spend more than that on coffee, you know, or a lot of people spend more than that on coffee, you know, and many other things. It is a very small, relatively speaking, amount. And so just have a think. Yes, it's not affordable for everybody, and that's one of the reasons that we do all of this stuff for free to help you guys out, right? The YouTube channel, the articles every week, all of that kind of stuff. It really, hopefully will help you guys. And if you want to dip into the program for a bit, you're more than welcome to. Cafe has said, what happened to the eye? Someone said he got rocked by a client at the pub. Yeah. No, it's, so this was from Jiu-Jitsu. I was a bit run down last week. It's worthwhile noting, you know, guys, everybody, I did a post in the members area to let you guys know what had happened. This eye was closed earlier this week. Not looking particularly fantastic. And it's just an example of a couple of things happening at the same time and a bit of bad luck, right? I had a graze. I normally get grazes around here from Jiu-Jitsu anyway. It's not a problem, right? You guys can obviously tell from the ears and stuff that there's impact on this area of the face from that kind of sport. But a graze, and then I trained, and I shouldn't have trained because I wasn't feeling 100%. So a graze and feeling a bit under the weather, the cold, which you can feel is still with me. And then it got a little bit infected. And then I trained, or rather before it got infected or after it got infected. And then I trained as well when I shouldn't have trained. And I knew that I pushed myself and I shouldn't have done. And then with my infinite wisdom, I did it again. And the body said, hey man, you can't do this. You can't run on empty. We're trying to fight a cold and you've got a little bit of an infection here. And then you're trying to kill yourself training too hard. And it forces you to take a break. Now, some of you guys have experienced that. A lot of you guys have experienced that. Yeah, my back's okay. Oh, it's been feeling a little bit better. Oh, I'll just go and do this thing. I had someone post on one of the comments on YouTube today, or over the weekend, or last week, and they said, I'm a busy mum and nanny, and I only have 10 minutes a day because I'm so very busy, but I've got this massive long list of diagnoses for my lower back. So basically, we've got a lot of stuff going on in the lower back. Give me 10 minutes a day, and I want to fix like what I can do to fix my back. And I'm like, sorry. Just like my eye has said, you need to focus on getting better now and put everything else second. Unfortunately, like in this storytelling, you know, you've got to put your back first. If you've got to cut back on some other things, cut back on some other things. Because your back will force you at some point to take it seriously and prioritize it. And the problem is, just like with my eye, when it forces you on its terms to take it as a priority, it's often when you least want to do that. And that's a scenario that so many people will allow their backs to get to. And on respect, like I've been doing consultations over the years with patients more than enough times to hear the story of, well, it's only been going on for the last 6 weeks. And then it's a case of, no, it's actually not. It's been going on and off for the last 20 years, gradually getting worse and worse and worse. And I've kind of been just putting up with it, resting for a few days and then cracking on. And I've never really dealt with it properly. And now it's got in the way of my son's wedding, and I hadn't been able to go on the family holiday, and now the back has forced you to take it seriously on its terms, not on yours, at your convenience. And so, you know, there's lessons in all of this. But for those of you guys that are going to get unwell at some point over the coming winter months, for those of you in the Northern Hemisphere, just bear in mind, focus on you getting better. Your body expends a tremendous amount of resources on the immune system, on fighting whatever it is, even a common cold, right? And trying to push yourself too hard because you feel like you've made so much momentum, right, with your rehab, can be to your disadvantage. I'm not going to be going back to jiu-jitsu probably until the end of next week. If I'm feeling up to it again. I certainly won't be at the start of the week. I'll be tentatively resuming like gym-based training once I'm feeling better, or a little bit better than this still. And it'll be light work. It won't be heavy work. It won't be hard work. It'll be testing things. And steadily I'll scale over the next couple of weeks back to what I was doing before. Be sensible. There's no need to rush. There is no need to rush these things. But at the same time, if you've spent a lot of time, effort, and energy over the years building up some good resilience in your body, then you've got more you can afford to lose. And then, yep, it's going to take some time to get back up to where I was, but that's the way we've got to do these things. What else have we got here? Cafe has said, the YouTube videos helped a lot already. I'm from Brazil and can't afford $20 a week, but the exercise videos helped a lot. Awesome. Awesome. I'm glad they've helped. I'm glad they've helped. That's why we put them out here. And we've got on the topic of BJJ, because it's mentioned, we do have a dedicated video on BJJ if you are looking to get back into it yourself specifically. What else have we got here on TikTok? Ooh, trying to push that off there. I just got told I have lumbalation of S1 and a bulging disc at L5-S1. And currently in extreme pain. The topic of lumbalation, sacralisation, and other such congenital abnormalities, and what that means basically is you were born like that. You were born with a situation where instead of the sacrum fusing into 5 vertebrae that are fused together, the top one here, the S1, looks a little bit like a lumbar vertebra, hence the term lumbalisation. And so it just means we've got an extra joint here. Now, fundamentally, this joint can often not actually be a useful joint. It's just a slight separation in the two bones in some way, shape, or form. And people often then gravitate onto that specific commentary. But the only thing that's useful here to know, or the main thing that's useful to know, is we have an injury at L5-S1. We've strained that disc. And our rehabilitation doesn't change in response to the lumbalisation or if it was sacralisation. The most important thing we can do is learn to stabilise the spine. That is what we will be lacking. We will be lacking the ability to stabilise the spine effectively. And if we focus on spine stability-based exercises, we can build back up. Rather than getting focused on some of these congenital abnormalities, a missing 12th rib, for example, or a missing lumbar vertebra. We've only got 4 lumbar vertebrae. All of these things are things that we've seen over the years on clinical findings, x-rays, examinations, etc., x-rays and MRI examinations. And they're there, and sometimes I think they get held onto too much too much by patients. That is often a distraction more than anything else. And Julia, yes, I do have the side step to go on to. And actually, that is actually a good point to transition. So just bear with me one moment. So let me just pull this particular bit up. So I wanted to demonstrate, I think that's also the side step up. But I wanted to demonstrate something briefly for you guys, well, this is for Julia, about sitting back into the step up. So the step up is one of the exercises that we use to stabilize the spine. It's used in conjunction with the squats, and it's a great way to provide asymmetrical load and focus on that load-bearing leg. But you have to focus on the load-bearing leg. So you guys might be able to see just here, we've got a little step. And the reason that we do the side step up is because one of the big mistakes that people make when they do the front step up is they are translating forwards and backwards way too much, okay? The purpose of this is not to just go up steps. The purpose of this is to practice integrating this front leg with the back leg as we go down and back up again. So we are controlled at all times over the front leg. Now, what some people will find is when they go down, the knee shears forwards quite a lot. So they're going down like that. And that puts a little bit of aggravation on some people's knee, especially if the knee is weak. Now, that's telling you something that your knee is weak. It will get stronger, but we want to again observe aggravation-free range of motion. And so what we can do when we're doing the step up is we sit back. People often try and do sometimes these really upright, like so, and that's not how we're supposed to do things. We sit back into the squat. So we're getting a bit of a hip hinge on, and we're leaning over the front leg. As I sit back more, I can make my shin more vertical as opposed to forwards and slanted, which decreases the strain on the knees. And so as I'm sat back into the step up position, I can then squat down and back up. Down and back up, and you'll also feel that the glutes get a little bit more involved as opposed to if we stay very upright like so. There, really hammering the quads quite hard. The side variation, as I said, is just an attempt to stay going up and down more rather than forwards and backwards, and so we're coming out to the side as we put our foot to the ground. Again, I can remove that foot and I'm still staying load bearing. So one of the real tests when we're doing, whether we're doing the side variation of the step up or the forwards and back variation of the step up, is that we're going up and down, not translating, and that if you remove the back leg, you wouldn't topple over. So ask yourself that question. Very important. So, hopefully that's helpful, Julia. Any follow-ups, please do post them. I know there's a little bit of delay on the YouTube anyway, so do let me know. Oscar said, during step-ups, which muscles should I feel, glutes or quads? I feel it more on the glutes. Oscar, I suspect you're doing a better job of that hip hinge that I just tried to demonstrate there. If you stand more upright, you're going to feel it loads your quads an awful lot more, and then you get a lot more fatigued. I would suggest that sitting back into it a little bit more is the appropriate way to do it. Unless you, and that's more from like a purpose point of view, but if you're specifically using it, like for example, if you do like seat squats, for example, those are going to really hammer the quads if you're trying to build quads. Fair enough. But in the context of the program anyway, I would stick to trying to do it in the manner that I described a moment ago. I've got a question here. Dardo Bartoli has said, as a sufferer of chronic sciatica and being pretty fit for a 60-year-old, I've now given up on these approaches to fixing. Turns out it's almost totally in my head. Fair enough. One of the big things to always consider is what fit means. I think that's a very, very important point of consideration. It's always helpful when thinking about these sorts of things to put it into objective measures, because the term fit doesn't really mean anything. Who are you talking to? Who's in the room when we're saying that? And I think the standard, the average of what might constitute fit is really not very fit at all. So just something to think about there. I also don't subscribe to things being totally in your head. Not at all. The head certainly has a role. That's not at all to state that the psychology, as I said before many times, the man who thinks he can and the man who thinks he can't are usually both right. But I definitely don't subscribe to this, oh, it's all in your head. I think that's something that a lot of patients also instinctively know is not true. Nicole said, how do you get a strong stomach? Everything hurts. My screws regarding sit-ups, planks, nothing works. We don't advise doing things like sit-ups and planks. The best exercises for strengthening your midsection, I would argue, are going to be the squat and the hip hinge. I'll explain why in a second. And by extension, some of those asymmetrical exercises that we mention often, right? The step up, the single leg hip hinge, even the Bulgarian split squat as well. Why are these exercises great? The core, because it's not just the stomach, it's the core that you're trying to strengthen there. You're not strengthening your stomach. Your stomach is an organ. We're strengthening the midsection, right? The area between the rib cage, the bottom of the rib cage, and the top of the pelvis. That's the region that we're strengthening. Those muscles hold the spine erect. They hold the spine upright. If it goes all to mush, then you just fall over. And so when we're doing a squat or a hip hinge or something like that, as we go down through the squat, if my midsection was not tense, including my back, of course, I would just kind of flop over. So the midsection needs to work to provide stability to this area in a load-bearing environment. The core also includes a spine that runs through it. And so any strengthening of the core in the most complete sense should necessarily involve load. I think scaling things like the squats and the hip hinges are the safest means of you steadily building the strength of the core. Adding in the asymmetry that comes from some of those asymmetrical exercises I mentioned, single-legged exercises, gives it a little bit more of an asymmetrical challenge. So you can challenge one side a little bit more. Even something like a farmer's carry or a suitcase carry could also do the same sort of thing. I think they're much more scalable than just doing endless amounts of sit-ups. And invariably, the sit-ups involve rounding your lower back and curling forwards, which is often not going to be helpful. I think the planks also are very, very difficult to scale in a tidy manner. How do you know you didn't just get bored of doing the plank? How do you know you should have stopped at 63 seconds instead of 85? It's very, very difficult, I think, to scale those kind of things in any meaningful way. Whereas with the squats and the hip hinges, doing them with good form, I think it's something that becomes much more easily and reliably possible over time. The only way you could arguably aggressively scale a plank in a similar sort of manner would be if someone's loading weights onto your back. But again, I don't think it's a very safe position to do that in, and the cost of failing could be quite unpleasant for you. So that's something to think about as well. What other comments have we got down here? My squat is limited, probably by flexibility rather than core. But if I stretch, everything gets upset. Often your squat, a lot of times, the squat is not limited by, it will be limited by flexibility to a degree. But part of the reason the squat is limited is that you're not very strong. And so your muscles don't want you to go any lower because you won't be able to get up. All these people that do a squat and then they do a squat and then they come down and then they, oh, and back up again, that kind of thing. You're weak. You're not very strong. You don't have any muscle there. Or you do have muscle, obviously. You're not very coordinated. You're not very good at practice these kind of things. And Nicole, as if on cue, has put a great comment in here. I don't mean that sarcastically. I mean that very sincerely. Squats aren't good. The surgeon says they're putting pressure on the spine. The surgeon is obviously giving a very, very incomplete answer there to be charitable. Sitting puts pressure on the spine. Squatting, it's the same pressure. Yes, now as we go lower and lower and lower, squat puts pressure on, squat will change the load going through the spine, assuming we don't keep a neutral spine. If we keep a neutral spine, this loading is going to be less than you sitting in the chair you will have had more load probably going through your spine, the areas that are injured, while the surgeon was telling you the squat was putting load on your spine, than you would have if you just did a body weight squat, right? Of course, the squat, if you put a lot of load on, will put pressure on the spine. That's how your spine gets strong. And that's how your spine gets weak. I've used this example before, but I'll say it again. Hopefully it'll help many of you guys, such as Nicole and others. Let me just save these questions. As an example, I've got two examples here. I'll go through the quick one first, actually. Those guys at the International Space Station that got saved lately, they were up there for a long period of time. They will have to do a good amount of rehab. Why? Because they have been under low gravity environment. They have not been getting the necessary stimulation to strengthen the bones, the muscles, the ligaments, the bones, the spine, the discs, etc. And so the body will degrade because it has no need to maintain that healthy, strong tissue because it's not being used. The body is breaking down itself and reconstituting it every single day. Some tissues faster than others, of course. And so it is the load that dictates how strong your body will be. So the idea that you should not put load through your spine is farcical. It's silly. The idea that you shouldn't put a specific number of load through the spine is also silly. And again, if you cut this bit of video and you just take parts of this argument in isolation, it'll sound very, very unwise. It has to be said in the full context. 80 kilos might well be very, very appropriate for someone, but for that same person, 8 kilos would have been too much and unwise for the health of their spine. It's all about the circumstances that you're in. You use load to build strength in the spine. If you are not exposing your spine to load, the question is, are you a human being that can operate in the real world? And the answer to that is no. Do you have kids? Are you going to pick them up? Are you going to put them in the car? The question is, do you want to be able to bear load? Or rather, a simpler question, do you want to be able to interact in the world? If the answer to that is no, then sure, follow the surgeon's advice. Never do anything that's going to build strength and stability into the spine. But I'm sure he's not suggesting that. He just hasn't thought through. He's a great surgeon. He's not very good at giving that kind of advice, though. He's operating outside of his realms. Just the same way I'm not going to give you the details of what surgery he might choose to do. He's not thinking through the answer very well at all. Careful rehabilitation that integrates exercises that safely apply a degree of load, maybe even just body weight, to start with, is going to be wise. But bear in mind, when you sit down, you put 40 to 90% more load through the lumbar spine, that same spine that he said you shouldn't do squats with. So that patient who's been told not to do squats because it puts load through the spine, it puts pressure on the spine, is going to go home and sit in the car to go home, putting 40 to 90% more load through the lumbar spine. I go back to the examples that I was mentioning earlier. I used to deadlift 230 something kilos, only for a couple of reps. I could not do that now. Why? Because I haven't done it in years and my body has broken down the ability to do that. If I did that now, I would probably injure something. Certainly how I'm feeling right now and having not trained for a week or so. Because I have deconditioned. I no longer have the makeup to be able to load bear 230 kilos through a range of motion. It would be unwise, it would be unsafe, it would be stupid, in fact. But you as a human being, and this is the decision you've got to make, have to exist in the world. You're going to carry your kids, you're going to carry your grandkids, you're going to carry the shopping, you might have to move a sofa, you're going to have to take the laundry upstairs. You're going to have to exist in the world which has load. So you have a choice. You can either carefully rebuild that with one of the safest exercises, assuming you do it safely, or you can say, I'm not going to rebuild or expose my spine to load. And I think that that choice is just, it's obvious which is the right choice and which is the incorrect choice. The only way to build a strong spine is to build its ability to load bear. And you need safe mechanisms to do that. And all of those mechanisms that build a strong spine have to involve load. It's like saying, how am I going to build strong biceps without ever curling anything? I'm not going to do it by looking at the weight. I'm not going to be doing it by thinking about it. I'm not going to be doing it by not using the muscle. You have to put load through the tissues. The difficulty is you have to get correct technique first, and you have to do it in a way that acknowledges the rate at which change can happen in certain tissues. Oscar said, which exercise can you recommend for hip external rotation? Oh, you put me on the spot there, Oscar. What are you trying to do for hip external rotation? You're trying to improve the amount of hip external rotation, where your glutes are going to do hip external rotation. You've also got the lateral rotators of the hip. They're going to do some work. Are we talking about improving that range of motion there? Well, then we're going to look into the department of doing stretches to help improve that. Let me know, Oscar. Sorry, I don't know why I'm turning away from there because the mic's on me. Sorry about that loud noise. What else have we got here? Can a few exercises to start off with? Does swimming help? Swimming is in the category of relief-based work. Swimming is not strengthening. So if someone says, go and do swimming to strengthen your back, they don't know what they're talking about. Swimming creates a low gravity environment, i.e. less strain. Your body is not going to get stronger by exposing it to less strain. Can swimming be used in combination with other things? Of course it can. Could you do a really good strengthening session in the gym using squats carefully with correct technique at the right amount of load, and then after your session go in the swimming pool to float around a little bit and give yourself that respite, that decompression, that unloading afterwards to help aid recovery? Yes, that's us understanding the role of different practices as they contribute to a improvement in your health and recovery. But we have to understand, what does this thing do? What does walking do? What does swimming do? What does it offer to the rehabilitative strategy? Is it providing relief and recovery from strain? Is it providing careful exposure to strain in order to get stronger? And then how can we pair those things together? That's why in the program we have the core relief work and we have the rehab work. The rehab work is what's getting you better. The core relief work is stuff like the bed decompression, the towel decompression, the lower body stretching. You could include swimming there, or floating around in the pool. I think swimming, a lot of people aren't very good at swimming, so you're just going to mess your back up if you try and do breaststroke or front crawl or whatever it may be, because you're not sufficiently competent in the technical department. So we have to think about how these things fit together. What else have we got here? I've never thought so much about sitting until my acute injury. Any tips on reintroducing sitting? Peter, go over to YouTube and have a look at Oscar's comment. You limit or the chat about Oscar's comment. You limit the amount of sitting you're doing. The parameter that you're bothered by is not the same parameter is not the same thing that you use to improve your strength. You use rehab to build your strength. You ask yourself the question, what is happening with sitting and why is it problematic? It's problematic because you're putting more load through the lumbar spine. As I said a moment ago, 40 to 90% more load than the standing position. And so what are you going to do to increase the ability of the spine to load bear? Let's just say you couldn't run for the bus because your cardiovascular system is in the toilet. It's terrible. What would you do? You'd set about a plan for exposing the cardiovascular system to strain, for example, using a treadmill or something like that, over a period of time to build up the tolerance. You wouldn't just randomly stand on the side of the street and look for random buses to start chasing down. That wouldn't be wise. You'd set about a process of improving your cardiovascular system. How? By putting it under strain. Going back to the surgery question earlier about squatting. The surgeon wouldn't go, oh, well, don't do anything that's going to elevate your heart rate. That's not a smart move. Now, while it might be strategic for very short periods of time to abstain from certain kind of activities that provoke certain systems within the body. It is not a long-term strategy. Just like, as I mentioned for me, with the eye, I am not going to be doing physically strenuous activities. This last week, I certainly haven't. And over the next week, I'm going to be careful in my reintroduction of that. But we don't just shy away from these things. So when it comes to reintroducing sitting, focus more on building strength and resilience in your spine. And you will notice, just like Oscar did, that all of a sudden he can, well, it's not all of a sudden, it's 5 months, but he's gone for a 3-hour sit-down meal and a 2-hour drive to get there. I'm assuming maybe 1 hour each way. And that he has objectively increased his ability to sit for durations by increasing his squat up to the point where he's doing 75 kilos on squats with very good form, by the way, for 10 reps, 5 sets. That's what we need to do. Nicole has said, wow, true, thanks. I just don't want to end up worse like Ronnie Coleman. So that is a very, very valid question. And I think Ronnie Coleman, having seen him in person, is in a bit of a spot of bother, to say the least. And I think there's a lot more that goes into that story that I'm pretty sure he's spoken publicly about than we might initially think. So number one, he talks about a bad surgeon doing a bad job. Number two, I don't think you're doing anything like Ronnie Coleman weights. You know, bear in mind, guys, elite level sport, such as what Ronnie Coleman would have done, for those of you aware of bodybuilding space, is not good for your health. It's not good for your health. That's not what we're advocating you guys do, though. So please bear that in mind. We're not advocating you doing Ronnie Coleman stuff, but building up strength and resilience to a reasonable level. You know, if most of you guys watching this right now, you're never going to get anywhere close to what he was doing, nor do you need to. But using the elite athlete that ended up in a bad way as a reason not to do strengthening work, that's not smart. That's not the right move. It's understandable. Oh, well, look at him. But we're not looking to do what he did with hundreds and hundreds of pounds. He's trying to become the best in the world at something, and that's going to involve actions which are going to exact a cost on the human body, something that he was prepared to take beforehand. Now, it sounds as though he's had a lot of bad luck afterwards as well. And judging by the way he's moving around the place, he's still doing what he can. When I saw him, I didn't see him personally, but he was in the gym that I was at last year or earlier this year. And so just bear that in mind. You know, something to think about anyway. What else have we got here? Guys, we've been going for around about 40 minutes. If you do have any other questions, please do post them in the comment section. I won't go on for too much longer today, unless there are a ton of questions. Yeah. Eluso said, how much pain is okay to go and do exercises? You're not pushing through the pain when you're doing your rehabilitation exercises. They should be aggravation-free with correct technique or correct choreography. If we're doing spine stability-based exercises, the spine is not moving when we are doing it. All of you guys that have back pain, have sciatica, remember this. It's when you went to move. You weren't just sat there still or lying down still or something like that. You weren't still and the pain came on, although the steady effect of load going through the spine is an element of movement, but you were still fundamentally. It's when you went to move that you got pain. It's when you went to get out of the chair. It's when you went to straighten up. It's when you went to turn around. It's when you went to go and get the doorbell. It's when you went to tie your shoes. It's when your spine moved that you got the pain, because you can't control movement in your spine very well. You haven't learned how to do these things. But when you hold your spine steady, you can get a night and day difference. This is why so many people notice in many cases when they've had it even for years, that just some simple instructional work can actually make the world of difference in the moment. That's why technique is so important. In the program, we go through the strategy material, you watch all strategy videos, then you go through the tutorial videos, then you start doing stuff. Because, for example, the squat is the great one, right? People go, oh, it hurts so much when I get out of the chair. Oh, gosh, and oh, it's so painful, I'm trying to straighten up. Oh, gosh. And you just teach them in one moment to, instead of doing that, get your feet underneath you, come to the edge of the chair, and then go straight up. Oh, it didn't hurt. You fixed my back. No, we didn't. We just stopped you violating principles of a neutral spine and hammering the poor little thing as you're going to get out of the chair. So what we did is education. The technical improvement can be quite stark in a relatively short period of time if you go about your rehabilitation exercises studiously. That's why that comment earlier with the person with a laundry list of back diagnoses on the MRI saying, I need just 10 minutes, give me just 10 minutes. Like, no, I'm not going to give you 10 minutes of exercises to do. You need to understand these things if you want to get better. That's why we put so much work into education, because it really makes a world of difference. Peter said, that's perfect. I want to make sure I'm sitting right, starting with 5 minutes, an hour, and will ogres. Don't know what that means. Most important thing you can do is try and sit with a neutral spine. You're not going to get it perfect, because generally speaking, when we sit, there's going to be an elimination of lordosis. Maybe 6 months ago, one of the members uploaded, no, was it? Yeah, well, I think it was a member uploaded a video. Someone that had gone through imaging. I'm pretty sure it was X-ray. Imaging people that were sat on a variety of different chairs and looking how, even in a kneeling chair, which is considered to be a good kind of chair, the lordosis in the lumbar spine is eliminated. And when we flatten the lumbar curve, we load the discs more. Specifically, we strain the posterior part of the disc. As you squash down on the front here, it drives the nuclear material backwards. And if there are compromises on the back here, we are in the risk of aggravating ourselves. Any other questions? Extremely bad pain below the coccyx. I was told it's referred pain. Started with the lower back. Yep, that's very, very common. When a lot of people will report that when they sit down, they get pain in the coccyx. When you are sitting down, your coccyx is not touching the floor. There's nothing happening in the coccyx. But when you're sitting down, you're putting more load through the lumbar spine. That's creating the aggravation. And commonly, people will say the pain kind of runs down the tailbone. It's perfectly normal, guys. Very, very common. It's not good. It's an indication we've got an injury down here. But don't focus on that. Focus on this. If you are somehow in a position where your actual tailbone is touching the chair and putting pressure on it, then the question is, how on earth are you sitting? The only way you can realistically get your tailbone to be touching the chair is if you're kind of sitting, doing a massive pelvic tilt, like so. And in the instance you're sat like this, firstly, oh God, it's cramping in my abs. Secondly, you're hammering flexion through your lower lumbar spine, aggravating the disc orders of magnitude more. So stop doing that, right? Sit properly. Sit in a position whereby you can try and get your thighs to go away from your hips, because that helps you keep a more neutral spine. The higher these come, you can see your pelvis rocks back, okay? Especially if you've got any tightness in the hamstrings, that's going to limit that. So immediately as you come up into this position, your pelvis is going to rock into a pelvic tilt, a posterior pelvic tilt. You're going to flatten the lumbar curve, put more pressure through the discs, create aggravation. And so try and sit in this kind of position like so. But the problem you'll get is you're not very conditioned, so you're going to get fatigued. The back muscles are going to get tired, maybe even up between the shoulder blades are going to get fatigued a little bit faster. And then you'll think, gosh, what am I doing? I'm making myself worse. And it's just a conditioning issue in those other areas. So hopefully that's helpful, guys. Those of you that have been with us on the live today, hopefully it has been useful. If you do need more help, I would strongly suggest, especially if you've been struggling for a long period of time, like we had the comment earlier, I think it was Nicole, if I remember correctly. You get told things by people that are in authority, such as a surgeon, or even other osteopaths or chiropractors. Don't do this, don't do squats. You need to be able to evaluate these things, and sometimes the guidance is quite poor. If you need more help and support and structure, I would definitely check out the link in the profile page over on TikTok. I've pasted it in the chat for those of you guys on YouTube. It'll be in the pinned comment as well. Watch the video there to get a better understanding of what the program's about and how it can help you guys. And thank you to all of you guys for the questions. I just see a couple more coming in on YouTube right now. Oscar said, should I do an x-ray or is it not necessary? I mean, my personal viewpoint, I think seeing the spine is really helpful. I've had x-rays, Lara's had x-rays. We've had measurements done on the spine to understand what position it's in, etc. Obviously, you guys know I had that additional x-ray where I had the fracture at the LS or the PARS. But understanding the spine is really important. Mum and Dad have had the same to get an understanding of what the spine is actually doing. So I think there's value in it, but obviously you've got to weigh that up. I don't think it's essential by any stretch, but it's certainly been helpful for me and the family in understanding what's going on in the spine, and also getting a stamp at a time when I was healthy and well. to see the structure and what's going on there, particularly in terms of the alignment. So that's something to think about. Anyway, Oscar. Yeah, any other follow-up on that, please do let me know. What else have we got here? I'm coming in. Thank you, no problem. Inspired for today said, I have a problem every time I lift and work the legs. Sciatica starts, it feels like the SI joint, and then a problem in the inner part of my right leg. When we're saying that, to me, I'm not sure what we mean by lift. If we mean lift as in the gym sense, when I do lifting in the gym, I'd really be looking at the exercises that we're choosing and or the technical application of those. And we need to be more specific. Like we said at the start of today's live, right? You have to be more specific about these observations that you are feeling. So often you guys will be specific in the wrong areas. Once you understand that the pain, as I've said before, I find this little mole and then I come down 1.5 inches and then 3 millimeters to the left, and that's where my pain is. You know it to a T, guys. That's not useful. That's not really that useful at all, right? Generally speaking. Understanding precisely when you lift, at precisely which load, and precisely which part of the repetition does the aggravation come on is the important part. In this here, we're focusing, it feels like the SIJ. That's irrelevant. When does it happen? That's what gives us all of the information. We should be recording ourselves when we're doing our exercises specifically. If it's happening in daily life, as so frequently it is, there's not a lot to glean from that, right? When I low bear the spine, my back hurts. It's about, I don't say this to be disparaging at all, but I say it to highlight why I'm saying what I'm saying. I've got a sprained left ankle. When I hop on it, it hurts. Cool. Great, right? I've got a bad back. When I expose it to load, it hurts. That's not helpful. Precisely when, with precisely what exercise, at precisely which point in the exercise. That's how we get results, guys. That's how we get results. That is how we get results, by being specific. That's what we encourage you guys to do in the program. Recording yourself when you're doing the exercises. Making sure that you are videoing those, especially if you're someone that's nervous about doing your rehab. Ask yourself the question, have you ever recorded yourself doing the exercises and played it back and compared it to what you should be doing? If the answer to that is no, you're not nervous enough. And I say that a bit tongue-in-cheek. But if we are nervous, why are we not recording ourselves? Why are we not taking notes? Why are we not comparing this? Tim, you should have seen it on Monday. I couldn't open the eye. It's periorbital cellulitis. Antibiotics have done a real good thing, because this was completely closed on Monday and Tuesday. Agnes has said degenerative bone spurs. Degenerative bone spurs are often a distraction. So often people will go and have imaging. They go, I've had back pain. It's come on 6 months ago. And then they see they've got something like degenerative bone spurs. And they go, those are the problem. No, they're not the problem. They are a sign that you have been abusing that area of the lumbar spine for a very long period of time. It's the soft tissues that most likely are the things that are causing your pain. Now, we could say if we've got some signs of inflammation in the bone, modic type changes, etc., then there's a bit of that going involved as well. But fundamentally, you strain the soft tissues. Those are what are causing your aggravation. And if the hard tissues are degraded to the point where we've got bony spurs developing, we better believe that the soft tissues are going to be in a sorry state too. And the soft tissues are the things that we can actually improve. We can start to build strength and resilience. That's what you are strengthening up. Well, you're strengthening up everything fundamentally. But getting those soft tissues to calm down through having greater control over the area, stabilizing that section of the spine, protecting that L5S1 or L45 more effectively can make the world of a difference. Alicia said, I live in the US. Can you put a video in the chat that focuses on a very weak core and lower back pain? I'm always sore when exercising. Alicia, that's literally what the program is about. So I would suggest, I might be able to paste it in here. Let's have a go. There we go. There's a link. Go and watch the video there that explains a little bit more about the program. And I think on that note, guys, I'll just have a look, see if there's anything else coming in. I don't think there is. I think we'll wrap it up. Guys, I hope that's been helpful. If you need any more support, again, over the weekend, check out the link in the profile page, guys. Those of you guys on YouTube, thank you for all of you for joining. If you're watching this now or after the fact, thank you for all the comments. They are appreciated. We do our best to reply to all of those as well. Those of you that want any more information about the Black Friday offer, keep an eye out for the Sunday email. And those of you that are in the membership as well, that's already gone out and there's been a notification as well today. You can always get that. If you've got any questions, you can reach out to us as well via the usual channels regarding the Black Friday offering. And guys, we'll hopefully be back on Monday. Now the eye is clearing up. So we'll see you for a live session on Monday. Have a great weekend, guys. Take care. YouTube, thank you. Take care, guys.